What you do within the first few minutes of an injury can make a huge difference. Unfortunately, between 80 to 90% of first aid care are actually done incorrectly. Now that we're almost heading into the spring and summer season, a lot of injuries occur. So in today's video, we're going to be talking about first aid care for 7 important injuries and also episodes that may occur. I'm Dr. Nkirik. I'm a pediatrician and pediatric ER doctor and also a mom of 3. While my focus is kids, a lot of this first aid care can be applied to adults as well, and then you follow up with an adult doctor for definitive care. Number 1, helping someone that has passed out, which we call syncope. Kids may pass out for different reasons. It may be because they haven't eaten or had anything to drink, but also because it's very hot or something related to the heart. In these situations, they may actually hit the ground or they may be close to it before they're supported and caught by someone around them. A lot of people incorrectly help someone that's passing out stand up immediately, and that's actually very unhelpful to them. Most episodes of fainting occur because the oxygen to the brain is actually decreased, and by helping them stand up immediately, you're further decreasing that oxygen, making them feel worse. This is what you actually want to do to help someone that has passed out or is passing out. Gently help them and support them to lay down on the ground completely flat on their back and raise their legs. Ideally, and for this to be effective, their legs has to be above the heart to allow blood supply and oxygen to flow back into their head. So you can grab some pillows and padded pillows and place their legs on top of it, or you can grab a chair from the side and place their legs on top of it so that it is elevated. Remove any tight clothing on them and cool them by either fanning their face or fanning the rest of their body. You can also put a cool cloth on their face and body just to help them cool down, especially if it's been really hot outside. Most people, especially kids, will start to feel better within a few minutes of letting them relax on the ground and putting some cool cloth on top of them. If you're unsure of what their medical history is, please hold off on giving them anything to eat or drink to make them feel better, or let someone who knows them or the person themselves or a professional tells you to. Some people may pass out because their blood sugar is low or because it's really hot or cool outside, but some others may also pass out because their blood sugar is really high. So giving them something to drink, especially something that has a lot of sugar, can actually make them worse. So now if someone is passing out, you want to help them lay down on their back, put some cool rag on top of them, raise their legs, support them, and call for help. Number 2, controlling a bleeding wound. This is huge. It is common and it is definitely scary. Some parts of the body, like the head, the face, the tongue, the fingers, especially the tip of the fingers and the toes, bleed a lot. So don't be surprised if there's a little small nick and there's a lot of blood flowing. What you need to do, and the first step, is to control the bleeding before you can now look and see what the injury looks like and how deep it actually is. There are 3 main things you want to do to control a bleeding wound. Number 1, hold firm pressure on the area that is bleeding, not gentle like a lot of people do. You need firm pressure to be able to control the bleed. If you have a cloth available, you can put a cloth on top of it, but if you don't, you can put your arm or your finger or your hand on top of the wound and hold firm. Number 2, if you had a cloth or gauze on top of the bleeding wound and you notice that it's soaked through with blood, don't take it out. You want to grab another cloth or gauze and place directly on top of the first one and hold pressure. While it might seem like you don't want the whole blood to be there, you actually don't want to take it out because then you're interrupting the process of blood clotting. So you want to take every other gauze and put it directly on top and then hold pressure. Number 3, stop peeking to see every minute if the bleeding has stopped, because it probably hasn't. You should always hold steady, firm pressure for at least 10 to 15 minutes before checking to see if the bleeding has stopped or not. Every time you peek, every minute you're checking, you're interrupting the clotting process and you're actually prolonging the duration of time it may bleed. So resist the urge to peek, hold firm pressure, put cloth on top, and hold persistently for at least 10 to 15 minutes before checking the area. After about 15 minutes, then you can check to see if it has stopped bleeding. If it has stopped bleeding, you can assess the degree, see how small or big it is, and see if this is something you can carefully take care of at home or something you need to seek professional care to help you take care of. Number 3, controlling nosebleeds. I'm going to be very honest because this is one of those things I did wrong, and a lot of us did wrong growing up. And of course, because we did this all wrong, we ended up swallowing a lot of blood, and the nosebleed actually took a longer time to resolve. Almost about 98% of families I see in the ER for nosebleeds are actually trying to control it the wrong way, and that is by leaning backwards. If you actually want to control a nosebleed correctly, is to hold the soft part of the nose here and not the bone. Squeeze it firm completely so you can compress the blood vessels underneath. If you're helping a younger kid with the controlling of nosebleeds, you may have to encourage and talk them through how to bleed through their mouth while you're squeezing that part firm. You want to lean forwards and not backwards. When you lean backwards, the rest of the blood is going back to the back of the throat and into the stomach, and in most scenarios this is going to cause them to vomit blood, and it becomes confusing if this is a completely different thing happening versus just a nosebleed. And then you want to hold for at least 10 to 15 minutes without peeking. You want to hold firm, lean forward, and then hold for at least 10 to 15 minutes. Number 4, first aid for minor wounds and cuts. If you've ever heard about the phrase, keep it simple, that's how I actually want you to think about wound care, because a lot of us are complicating wound a lot of things that are actually not needed and not necessary. So here's a simple version of what I want you to change and do today for any small cuts and wounds that you're trying to take care of at home. Just wash the area with clean water and mild soap. It does not have to be bottled water. Tap water is just fine. If it's in the summer where it's been super hot, you want to first check the water and make sure it's not burning hot before you use it on your child. For the type of soap, you do not need any antibacterial soap like Dettol or any other fancy. You can use the regular soap you bathe with, like the Olay, the Dove, and make it a little bubbly and then use to wash the area. Please leave the hydrogen peroxide and the alcohol out of wound care. These are no longer recommended. Alcohol burns for wounds, and then second, they both can kill the cell around the wound and actually delays wound healing. So while these were a staple back in those days in our homes, science has found that mild soap and water is all you need to keep the wound healthy and healed better. When you are done washing the area mild soap and water, you can dab it with a dry gauze and apply petroleum jelly like Aquaphor or Vaseline on top of it. If you prefer and feel more comfortable using an antibiotic ointment, please choose bacitracin and not Neosporin. There's been a lot of cases that some people are allergic to Neosporin, so that can actually make the wound worse and make it start looking like a rash and delay healing. And when you're done applying, cover with a clean band-aid. So wash with mild soap and water, dab to dry, apply petroleum jelly or antibiotic ointment, and then cover with the band-aid. That's as easy as you want it to be. If you think the wound is huge and needs a professional to take a look at it, please seek professional care so you can get the best care. But if you think it's something small and mild that you can take care of at home, then you should repeat the same process twice a day to reduce any risk of infection for the next 5 to 7 days. You actually need to only keep it covered for the first 3 days, but because kids are active and wanting to different dirt, you can actually keep it covered after cleaning and applying bacitracin or petroleum jelly for the next 5 to 7 days. Number 5 is snake bite. I live in Texas and this is huge, so I always like to talk about it. After a snake bite, a lot of people assume that tying a cloth or tying a tourniquet around the area is a good idea to prevent blood flow and also prevent the spread, but this is actually not correct. It can be dangerous in 2 ways because it can cause the poison concentrate in one area, and that can actually be damaging to that particular area. Number 2, when you take the tourniquet off after being tied for cause the venom to release into the bloodstream, and that can actually cause the person to get sicker and may lead to significant harm. So here are the things you should do instead if you notice or witness someone with the snake bite. Help and encourage them to keep their body completely still. This helps slow down the flow of the venom inside the blood. Help them to place the area of the bite to be lower than the heart. If it is the arm, they should not place it up. It should be placed lower than the level of the heart. Remove any tight clothing or jewelry around the site of the bite. Snake bites can get very swollen pretty easily, so you want to make sure you remove this area so it does not become more difficult to remove when the bite has become swollen. Call for help as soon as you can, or help get the person to the nearest emergency department for them to get definitive care. Some snakes have venom, some do not, so some snake bites might need an anti-venom while some don't. So one thing that's very helpful is being able to get a picture of the snake or have a very good description of the snake to be able to manage this properly. Number 6, head injuries and bumps. Kids and head bumps and head injuries almost always go hand in hand. This is because kids are very active even from when they're babies and toddlers, and they start to fall a lot. And because they're very head heavy, the head is one of the first places they bump frequently. So either at home or in a playground, head injuries are very common and they can be very stressful to deal with. I have a much longer video on head injury and how to care for them here, but the first thing you want to assess is to make sure that your child child is safe. If your child walks towards you or comes towards a known person after a head injury, it's likely they're actually okay. So what you need to do is console them and observe them over the next few minutes. But if after a head injury, they're still laying on the ground, seem to be altered, not knowing where they are, they're unconscious or having a seizure, please do not pick them up. It's a possibility they may have other injuries from their neck or bone that you may not see. What you want to do is actually leave them on the ground and stay by their side and call for help by a medical professional like 911 or the numbers that call care in your area. In this severe cases, your child is probably going to take into an ER where they're going to get much better care. But if your child had a mild head injury, they bumped their head, they came to you crying, console them, give them some pain medicine, and then check the sides of their head to make sure they don't have any bumps or swellings, that is very obvious to you. If there's a bump on the head that you notice like a goose egg bump, you want to apply ice on it immediately. While this is an abbreviated version of first aid for head injuries, for a more video on head injury, there is a playlist that includes both head injuries and also how to manage goose egg bumps. Number 7 is swallowed chemicals or objects. Kids are very curious about containers and everything around them, and most of the time they're going to get into something while they're playing or while they're exploring their curiosity. Gagging kids when they swallow a chemical or drink a chemical or attempting to induce vomiting is actually a thing of the past and is no longer recommended because it causes more harm than good. The reason why we don't recommend gagging or making a child who drank a chemical vomit is because the chemical that's already passed through the feeding tube into the stomach, you're making it come back up again to pass the feeding tube twice, and this actually causes double damage and causes a lot of burning. The second reason is a lot of them may aspirate during the process of vomiting, meaning that this chemical may actually make its way into the lung and cause what we call chemical pneumonitis, which is very dangerous for their lungs. Here's what I want you to do instead if your child accidentally drinks a chemical. Number 1, wipe their mouth because you want to get the rest of the chemical from around your mouth to decrease any damage that it's already making. Number 2, call poison control immediately or call a healthcare provider. A lot of these people are already trained in how to manage different chemicals and they're going to be able to advise you on what to do immediately. Number 3, while you're waiting to hear back from poison control or healthcare provider, check the container of the chemical they drank. Some of them may recommend giving milk or water, and you can give that while you're waiting to hear back, but otherwise hold off on giving anything to your child. And of course, if your child becomes unfortunately unconscious or altered or becomes critical, you want to call emergency services because they're more likely to help you with stabilizing your child immediately. In the same line of swallowing dangerous objects, following button battery. Button or lithium batteries are very common and can be found in so many things. It can be found in fob keys, can be found in car keys, in hearing aids, in calculators, so they're readily available to kids. And again, because kids are very curious, they can get their hands on it. But when these batteries are swallowed, they can do damage to the GI system within 2 hours. So here's one important thing I want you to know. If anyone, any child or baby ever swallows a lithium battery, you want to give them honey immediately. This has been studied well and been shown it actually decreases the amount of damage it can do within hours. You want to give them 10 ml of honey every 10 minutes for 6 doses. If a child is younger than 1 year old, you cannot give them honey, and we do not recommend giving them honey. If you don't have honey in the house and your child swallowed a lithium battery, you don't want to go to the store to buy because that delays care. You want to take them to the nearest emergency room immediately. So in summary, for chemicals, don't induce vomiting, look at the bottle and see if it tells you what to give. For button batteries, you want to give honey unless your child is younger than 12 months old. So you will hold and go to the emergency department immediately. So remember, first aid is important. What you do first within the first few minutes can change someone's life or how they recover. So please do the right thing. As always, let me know in the comments if there are first aid care that you want me to talk about, or there was anything I talked about that I found interesting or maybe a little bit different from what you know. As always, thank you for watching, and I will see you in the next video.